Hi guys, Anna English here, and we're going to dive straight in and learn some vocabulary around childbirth. So first, we talk about having a baby or giving birth. So you have a baby, but you give birth to a baby. You may also hear the verb deliver used when talking about having a baby. You deliver a baby, and often the room in the hospital where the baby is delivered is called the delivery room. It actually reminds me of the story of babies being delivered by a stork. Do you have something similar in your country to explain where babies come from? If you do, put it in the comment section below. So I just want to know if there's anything special to look forward to, anything amazing coming up in my future.
Oh, I'm sensing something.
But sorry, isn't that a fishbowl?
Shh, the spirits are trying to talk to me. Yes, I see. italki.
italki?
It's an online language learning provider.
Online?
Yes, online. Which means it's very convenient. You can have a lesson anytime, anywhere in the world, as long as you have a device and an internet connection.
And will I meet some nice people there?
Oh yes. All the teachers are very special, and you can choose your favourite from a very long list, and oh my.
What is it?
I've never seen anything like this before. These are incredible prices. It's so affordable, and if you are a new sign up to italki and click the link in the description box below, then you will get $10 credit when you make your first purchase.
$10 credit?
$10 credit. And they also offer so many languages, I wouldn't know where to start. Oh, I think I need to have a lie down.
You will be giving birth to your baby when you are full term, hopefully. If you don't remember the term full term, we covered this in the pregnancy vocabulary lesson, which I will link up above now or down below in case you missed it. Full term basically refers to around 40 weeks of pregnancy where the baby is fully developed. So you are full term. If, however, you go into labour or you have your baby earlier than 37 weeks, you are preterm, and a baby born preterm is a premature baby. Now, if your pregnancy lasts longer than 40 weeks, perhaps you go to 41 weeks, 42 weeks, maybe even longer than that, you are overdue. You're overdue. Your baby is overdue. Commonly, when talking about giving birth, we will talk about how we gave birth. There are two main options. You either have a vaginal birth. Now, this is the medical term, vaginal birth. That means the child comes out through your vagina in the way that nature intended. However, us Brits get embarrassed when saying words like vagina or vaginal. So instead, we prefer to say natural birth. I had a natural birth. Another way to give birth is via a Caesarean section, otherwise known as a C-section. Much easier and quicker to say. A C-section is where a cut or an incision is made through the abdominal wall and the baby is released that way and brought into the world through your tummy. Now, if you have any kiddywinks, then I would love to know whether your children were born naturally or whether they were born via Caesarean section. Let me know in the comment section below. You may hear some people saying that they had a water birth. This is a vaginal birth. The baby was delivered naturally, but in water, in a special pool, in the labour ward, or perhaps at home. In order to have a natural birth, you must go through a process called labour. Labour is laborious. Labour, the word, means hard work. So your body does a lot of hard work in order to push that baby out of your body. When talking about this process, we talk about going into labour and being in labour. So if a woman comes into the hospital and she is about to give birth, you would say this woman is in labour. Hopefully labour will start naturally or spontaneously, but in a lot of cases labour will need to be induced. So an induction will be necessary. If your labour is induced, then medical intervention is required to start the labour off. There are a number of ways in which they can do this. First of all, your midwife or your doctor will try a membrane sweep or a cervical sweep. This is where they rub their fingers along the cervix to separate the membrane or something like that. But they basically give it a little rub to hopefully get things going. If that doesn't work, then you will be properly induced. First, they will try something called a PESSARY. A PESSARY. This is a tablet, or sometimes they use a gel, that is inserted into the vagina and it melts and releases hormones, I believe, to stimulate the cervix to thin and start the process of labour. Another way to induce labour is to use a hormone drip. So they drip fluids directly into your veins, and this is done via a cannula, which is a needle and a little opening that they put into your vein in your hand usually, so that they can easily get blood out and easily put fluids in a cannula. Very painful. Once you are in labour, if you're in the hospital, you are likely to have at some point a vaginal exam. Now the vaginal exam is firstly to check, has your mucus plug come out? A mucus plug is a plug of mucus that plugs the cervix. So it's the little plug that keeps everything in the uterus. And once that comes away, hopefully then your waters will break. Now the waters breaking, we're referring to the amniotic fluid in the fluid sac, the amniotic sac that surrounds the baby. Once that ruptures, all the fluid comes away and the baby is ready to be born. We talk about this coming away of fluid as the waters breaking. So where did your waters break? Now my waters broke at home, luckily, but it happened pre-term and I wasn't in labour. My membrane ruptured, my waters broke, and all the amniotic fluid came away, and then I knew I had to go to the hospital because at some point soon I should hopefully go into labour. And once those waters are broken, that baby is no longer protected, so that baby has to come out. In my case, when I arrived at the hospital, my waters had broken, my mucus plug had gone, I had to have a vaginal exam. And in this vaginal exam, they are also looking to see whether or not your cervix has begun to dilate. Dilation is the word that we use to talk about the opening of the cervix. And we talk about it in centimetres. So normally when you're about to give birth, your cervix will be around 10 centimetres dilated. So it'll be quite wide open, probably not that big, maybe more like that. And that will then allow the baby to come through. But earlier on in labour, in my case, for example, when I was in labour, I only got to around 4 centimetres dilation. And that was tough. The pains that you experience during labour are referred to as contractions. Now the word contraction has many different meanings, but in labour it solely refers to the tightening of the muscles that naturally push the baby out. And contractions can be very, very painful, which is where you hear women screaming in agony on all of those TV programmes and in those movies. So now we're on the subject of pain, let's talk about the pain relief that you use during labour. Firstly, we have hypnobirthing. Hypnobirthing is where you use the power of positive thought. You use techniques like breathing and visualization in order to have a drug-free childbirth. So if you don't want to use any medicine whatsoever, you just want to do it naturally, then you use hypnobirthing, which is what I tried to do. Commonly, many women will use gas and air, which you just suck up and it instantly relieves the pain. Apparently, I haven't tried that myself. If you have, please let me know. What was it like? There are, of course, then pain relief medicines that you can have injected. There are a number of those, or you can opt to have an epidural. An epidural is an injection that goes into your back and it makes you paralyzed from the waist down so you don't feel any of the pain. Similar to that, you have something called a spinal block. The difference between an epidural and a spinal block is simply how long it lasts. I had a spinal block when I then had to go for an emergency C-section. So they gave me a spinal block so I couldn't feel the incision in my abdomen. But when that spinal block wore off, whew, I definitely felt it. If you're having a natural birth, then there are a few things that will happen. The baby will start crowning when he comes towards the end. So when you can see the baby's head, when he's just about to pop out, that is the baby crowning. Now, hopefully his head won't be so big that he tears you. When we talk about a tear down below, we talk about it in first, second, third degrees of tear nastiness. So if it's a very bad tear, it might be a third degree tear. If it's not a bad tear, it will be a first degree or a second degree. I'm not a doctor, I'm not quite sure exactly how it works, but they are tears. Now, to avoid you tearing down there, you might have to have what's called an episiotomy, where the doctors or the midwife will cut a little bit of the skin down below in order to release a bit of pressure to allow the baby to come out without tearing you in a bad way. And that's called an episiotomy. Now, the area they usually cut is between the vagina and the anus, and this is called the perineum, I believe, the perineum. Oh, lots of new words. Episiotomy, perineum. If the baby is struggling to come out, then the doctors may need to use forceps, which are like 2 spoons that they put in to help pull the baby out. Now, whether you have a natural birth or a C-section, there is a risk of hemorrhaging, especially once you give birth to the placenta. Do you remember what the placenta is? We talked about it in the pregnancy vocabulary. It is the interface between the baby and the mother, attached to the baby via the umbilical cord. So that is the placenta. Once you give birth to that, some people have a risk of hemorrhaging. And at some point after the baby has been delivered, someone has to cut the cord. Usually it's daddy who cuts the cord, but it might be some other member of your family or a friend, or maybe just one of the medical professionals. When I was in the hospital, I shared a room with a lady suffering from pre-eclampsia. Pre-eclampsia. Pre-eclampsia is a condition involving high blood pressure, which is a danger to your pregnancy. So when you are pregnant, your doctors will keep an eye on you to check for signs of pre-eclampsia. Once your beautiful baby is here in the world, their first bowel movement, their first poop, will be called a meconium poo. It's a very different texture to their poo afterwards. The first few days their poo is like tar, it's black, it's sticky, and we call it meconium. Ugh, it's very sticky. Finally, the types of medical professionals you are likely to come into contact with throughout pregnancy and childbirth are a midwife, who specialises only in supporting pregnancy and childbirth. Then above that you have an obstetrician, which is a doctor that specialises in pregnancy and childbirth. Then we have a paediatrician. A paediatrician specialises in the treatment of children. A gynecologist is a doctor that specialises in women's reproductive health. So everything down there, a gynecologist will look after. And finally, if you require an epidural, so if you're having a C-section or an epidural for natural childbirth, you will see an anaesthetist. Anaesthetist. That one is a difficult one to say. Anaesthetist. Well, that was a lot of vocabulary to squeeze into one lesson. If you are interested to know a little bit more about my personal labour story, my childbirth story, then you can watch the video which I made all about my experience, and that's appearing above my head, or it will be down in the description box below, over on my personal channel, Anna's Big Adventure. As always, I do hope you found this helpful. If you did, please give it a thumbs up. Don't forget to subscribe and press the bell notification button so you don't miss out on any future lessons. And until next time, take care and goodbye.